Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hello everyone, welcome. This is Dr. Jacobs. In this video, I'm gonna go over how to diagnose lumbar radiculopathy. I will go over 4 common signs and symptoms that might indicate that you have lumbar radiculopathy. I will also go over at the end of this video 2 special tests that we use in clinical setting to help us to diagnose lumbar radiculopathy. So before I go over the signs and symptoms, we need to understand what is lumbar radiculopathy. It's actually compression on the nerve around L4 and S1, and you usually see it here on this area. That this area you will have like bulging disc, herniated disc, or fibrotic tissue. Could be other issue that cause compression on the nerve that going down to your legs, and you can see it here in this model. So we have the pelvic bone here, and you have the sacrum, the coccyx, and you have the lumbar spine in this area, and usually it's occurring L4S1. This area you have compression on the nerve that going down to your legs and supply the back of your thigh, legs, and foot with the nerve ending. So the first common sign and symptoms is low back pain, buttock pain, and your pain going down to your legs, and that due to the distribution of the nerve, the compression that caused those symptoms of pain. The second sign and symptom is numbness, tingling. Also with severe cases, you start to have weaknesses in your leg, your foot, and you feel numbness, tingling in the back of your leg, your calf, and your foot. This is a good image for lumbar radiculopathy. When you have compression on the nerve, you will start to feel the sharp shooting pain that going down there on those areas that supply the lower extremity with the nerve, with the sensation, with the ability to move your muscles. So when we look here in your disc in your spine, that could happen from herniated disc, but that's not the only reason. I will have a link underneath this video for the causes and risk factor for lumbar radiculopathy, so you know how this occur. The third sign and symptoms for lumbar radiculopathy, you start to have pain that's increased with movement. The more you move, the more you're experiencing pain, because that causes more compression on the nerve L4 to S1 and cause more irritation to the nerve, so you will have more symptoms. The fourth sign and symptom is your pain will be decreasing with rest. So pain increasing with movement and decreasing with rest. So one of the tests we use it in clinical setting to diagnose lumbar radiculopathy is the slump test, or like bending forward like this. And actually this test need to be done passively. It's basically you slouch forward with your head flexed like this, and someone take one of your legs, especially the side that you have symptoms, and straight your knee like this image, going from the sitting position to this position, and flexing your dorsiflex your ankle. And when this test done, the positive sign that you will have sharp shooting pain going down to the back of your hip, your leg, your thigh, and your foot. When you start feeling sharp shooting pain, that's a sign of potential lumbar radiculopathy. So you can try both sides to see the difference between positive and negative, or to test both sides. It's very common to have it in one side, but very rare cases is actually happen in both sides when you have really 2 issues happening at the same time. The second test we use in clinical setting, that's also a passive test. You actually need to lie on your back, and while you're lying on your back, your knees straight, and someone gonna take your foot up to about 60 degrees here passively, so that means they lift your legs up, and when you start to feel sharp shooting pain going down to your leg, your thigh, your foot, that is a positive sign for having lumbar radiculopathy. So positive sign, when we do the passive movement for the leg, you will start to feel sharp shooting pain going down to your legs. Negative sign, you will not feel that sharp pain. And the other thing that's very common misconception is you feel tightness in here. That is different than sharp shooting pain going down to your legs. If you feel tightness here, and a lot of people will feel that because you have tight hamstring, that does not mean a positive test. And I will leave a link below for the 3 most powerful treatment that's very effective to treat lumbar radiculopathy. If you have any question or comment, leave it in the comment section and I will answer it in the future video. See you soon. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below or go to ASTRinstitute.com.